It's my pleasure to introduce you to our next presenter, Jodi Sugerman-Brozan. Jodi is the Executive Director of MassCOSH, and for those outside of Massachusetts, that stands for the Massachusetts Coalition for Occupational Safety and Health. She brings more than 25 years of experience working for environmental and social justice in Boston. As Executive Director of MassCOSH, she oversees all aspects of their work to ensure that all workers can go to work, earn a fair wage, be treated with respect and dignity, and go home to their families alive and well. She has led MassCOSH work to develop strategies to address the high rates of addiction and overdose for workers in Massachusetts, including coordination of their peer training pilot project this spring.
Thanks for having me, and thanks for that very kind introduction. Thanks so much for inviting me to be part of this really important webinar. I think that you will hear in my presentation the same really call for action that is so important in this current moment. So I wanted to start with some information to talk about our Occupational Health and Safety Administration here in the United States. One of the reasons that MassCOSH has been at the forefront of supporting workers during this epidemic is because OSHA has been so missing in action. This is the agency that's meant to protect workers and meant to be there to ensure enforcement of health and safety standards. Unfortunately, that they have been shirking on their responsibilities, which is an understatement. So recently, the Kaiser Health News did an investigation in which they looked at all of the OSHA complaints. And since March, there have been more than 4,100 COVID-related complaints for healthcare facilities alone. And one of the really just heartbreaking pieces of this is that they found that at least 35 healthcare workers who had submitted complaints to OSHA have died before OSHA has taken any steps to enforce or provide protection. They have closed, in fact, all of those complaints, and a third of those healthcare-related COVID-19 complaints continue to be open. So MassCOSH has, in Massachusetts, not just for the healthcare industry, but for all essential workers, really stepped in to try to provide resources, support, guidance that workers need to be able to take action. In Massachusetts, the complaints for healthcare facilities were far and away the largest category of COVID-related complaints, accounting for 150 or more than 30% of the 486 complaints. Just some examples: at a major Boston hospital, disinfectant wipes were locked up, reuse of contaminated gowns, providing minimal PPE, and most, if not all, of these complaints were closed by OSHA without even an investigation. And this is true of all industries here in Massachusetts. And I want to just stress that here in Massachusetts, in Region 1, we have some very good staff within our region at OSHA who have long been known to be partners in this work, but their hands have been tied. The new guidance that has been given to them around enforcement has prevented them from taking the steps needed to protect workers, and it's really coming from the top down. This is federal guidance coming directly from the Trump administration. So for MassCOSH, here I'm going to shift from the federal to the state. So we really looked at wanting to ensure that workers were going to get the protections. If the federal government wasn't going to come through, then we wanted to see the state come through. And as they began, after watching weeks and weeks of essential workers become ill and watching that the essential workers even die as a result of exposure to COVID-19 in the workplace, we pulled together a group of health and safety experts to create a set of recommendations to the governor's reopening advisory board, in which we called for enforceable workplace standards, better screening, testing, and tracing, and a protection of workers' voices and job protections, in particular protection of workers from retaliation. the governor of Massachusetts put together a reopening advisory board that sadly did not include any representation from labor or workers or even any health and safety expertise. The director of the Massachusetts Department of Public Health sat on that board, but without much voice and without support of other occupational health and safety experts. So it wasn't surprising to us that on May 18th, when the governor of Massachusetts released his workplace standards, that they did not even come close to meeting what we felt was needed for health and safety protections. So we issued the governor's plan failing grades. While there are workplace standards that were created, all of them are guidelines without any clear enforcement mechanisms. And in fact, enforcement was booted from the federal government, passed the buck to the state, and the state passed the buck to local boards of health who had even less capacity and weren't even at the table to help design these health and safety protections. It did not protect workers from retaliation, didn't provide enough sick time, it did not address issues around unemployment insurance, and an issue that was brought up in the last panel, it failed to address issues around occupational presumption for workers' compensation benefits. And another piece which has been really critical is that the governor has from the beginning failed to collect data on the occupation, industry, and employers of COVID-19 positive patients. And that is a really critical failing because it does not allow us, it prevents us from identifying the worker groups and workers that have been most affected so that we can create and support protections for those workers. And that's something I'll get into a little bit more that MassCOSH is actually taking on to try to do more data collection on our own. So what does the state require? It is, in my opinion, somewhat of a joke in that not only are the standards not strong enough, but they simply require employers to self-certify that they're meeting basic mandatory workplace safety standards. There are also some industry-specific standards, but most of the standards fall into the categories of social distancing, hygiene protocols, staffing and operations, and cleaning and disinfection. To self-certify, all they need to do is fill in a checklist that says they have a control plan, attest that they're in compliance, and hang these posters, which you see on the slide. So again, there is no enforcement mechanism put into place, and there is no real teeth to the standards, though they are, I will say, better than many states across the country. And in fact, Massachusetts is one of only 13 states total that have some level of health and safety protections, whether or not they are mandatory in place. And about a half hour ago, the state of Virginia is the first state in the U.S. to pass a mandatory enforceable temporary protection standard for their workers. And it was a monumental effort to get it done, but they are the only state in the entire country with mandatory enforceable health and safety protections. So what does enforcement look like? So because there are pages and pages and pages on the website for the reopening of Massachusetts, and in those pages and pages, there is not one place where a worker could find how to issue a complaint, yet the only way to get any enforcement on these standards was to issue a complaint. So we really called out the governor for this, and we were very lucky in that our Attorney General stepped in and created a form for workers to submit these complaints. We also at MassCOSH, with our partners within the labor movement, put the information out far and wide that the steps workers need to take were to call local boards of health or the State Department of Labor Standards. But the State Department of Labor Standards is playing a pretty minimal role. They're only working to enforce when a business that is open and should not be open is addressed. So since May 19th, when the state entered phase 1 of our reopening here in Massachusetts, the Massachusetts Attorney General has received 911 complaints on their online safety form. That's almost 20 per day. And you can see here the industries that were affected the most since we've begun to reopen are retail and sales. And this includes pharmacies, grocery stores, but also all other retail and sales. And it's worth pointing out here that complaints are coming not just from workers, but also members of the public and customers, which means that it doesn't surprise me to see that top line being retail and sales. And you can see restaurants and hotels are next, followed by hospitals and nursing right afterwards. And this is after the reopening. So this is not even during the initial state of emergency that went into effect on March 16th, but this is from May 18th forward. We are still receiving almost 2 complaints a day from workers in hospitals, nursing homes, and healthcare facilities. And that is simply complaints to the Attorney General's form. This is not complaints going to local boards of health, et cetera. So this is really, to us, very striking and very concerning that we are continuing to see workers who are that concerned about their health and safety, even with mandatory workplace safety standards that are in place without any enforcement mechanism. This is a really troubling graph to me. And again, this is just since May 19th. And I want to point out that here in Massachusetts, that there is, like across our country, an unequal impact from the virus. Hispanic residents in our state make up 12% of the population, but their rate of positive cases is nearly 30%. Black residents represent 7% of our population, but their rate of positive COVID-19 cases is double that at 14.4. And overall, the data show that the rate of positive cases among Black and Brown residents is more than 3 times that of white residents. And we believe that that has a lot to do with work, because we know that people of color are disproportionately represented in those essential work industries. And you can see here the data on Hispanic and Black workers. Black workers make up just 7.1% of the Massachusetts population, but they're 41.2% of the nursing and home care aides, 37% of LPNs, 12% of RNs, 33% of taxi and ride service drivers. And Hispanic workers make up 9.7% of the total number of workers, but 79, almost 80% of laundry and dry cleaning, almost 34% of food preparation. So we believe that the disproportionate impact on people of color here in our state and across the country certainly has many factors, but work is not the least of them. So what do we need to ensure that as we move forward, workers are going to be protected? So we've set through some demands. We believe that workers are not expendable commodities in the push to reopen our state, that they must be protected from exposure. Their lives depend upon it, and frankly, so do ours, because work is a key way in which this virus is being spread. So we are calling for stronger enforceable health and safety protections, and enforceable meaning that they actually have the ability, whether it's through local boards of health or the state, to issue fines, to close businesses where needed, and to ensure that there's a joint effort by employers and employees to work together to do hazard assessment and COVID protection planning for every industry, every job site, because every job site, every workplace is different, and workers need to have a voice in what the protection plan looks like. We're also very concerned about the lack of protections that our state has to address aerosol transmission and microdroplets. So we are pushing very hard and continue to try to push very hard to ensure that that is addressed. I think it's going to be a major issue as we look to return to school in the fall. Upwards of 70% of our elementary schools, 60% of middle schools, and 40% of our high schools in Boston have poor indoor air quality and ventilation. That is totally troubling, and that lack of ventilation is going to be a critical risk factor for teachers and students. Here in Massachusetts, since we are depending on our local boards of health, we really are saying that they need to be given appropriate support and guidance and resources. And the governor in our state has actually undermined their authority by requiring that they offer escalating enforcement. In other words, they must reach out and work with employers up to 5 times before they can do a cease and desist. We're saying they should be able to close a business when they need to, and that they should have the ability to issue higher standards if they believe they're important. And that's something that they had prior to the governor's workplace standards, that the guidance from the governor actually stepped that back. The governor also said that local boards of health cannot close businesses based on the standards that have been issued without a court injunction, which weakens them as well. We believe that needs to change here in Massachusetts, that if we're going to rely on local boards of health as the only protection workers have, then they need the support, guidance, resources, and authority to do what needs to happen. We also want to see and ensure that workers' rights are protected, especially workers' rights to report and refuse dangerous work without retaliation. We know that there is an increase in retaliation, and we are seeing it in the complaints issued to the Attorney General's office. We are seeing it and hearing about it regularly. We're seeing it in the whistleblower complaints that have been issued to OSHA. There were over 90 of them in our region alone. OSHA is supposed to prevent and enforce the anti-retaliation law. 90 complaints, no action. So we want to see the state step in and ensure that workers are protected from retaliation. And finally, we need to collect that data on occupation and industry, and we need to have the capacity to investigate workplace outbreaks and close businesses due to COVID-19. Right now, the way that Massachusetts is collecting data is that the information provided may have their occupation, although it's missing on 80% of the data collected, and it otherwise includes their home address. So you may have 10 workers from one work site that all test positive, but when the state sees that data, all they're seeing is the 10 different cities and towns in which they may live. The only way we're identifying workplace outbreaks is by reports from businesses that have to report to local boards of health. Again, not mandatory, no real fines if they don't do it. So we rely very heavily on local boards of health to know their own communities and be able to start to identify these workplace outbreaks just by their knowledge of their own communities, not because we have any systemic way of doing that. And again, we know work is a critical way in which people are being exposed to this virus, getting sick and even dying. And really also a way that it's being spread in the community. So we really need to do more to be collecting the data necessary. Through this set of demands, MassCOSH has created a set of legislative priorities. One is one that has been talked about several times today, and this idea of occupational presumption for essential workers. We know and hear of workers that are being denied the benefits, or families who've lost workers who've died as a result of exposure are being denied the benefits that they deserve. And there are a number of bills here in Massachusetts right now to protect first responders, to protect healthcare workers. There's one bill which is meant to protect all essential workers who worked outside the home during the time prior to reopening. And we really think that this is a critical bill, and that occupational presumption is something that needs to happen even for workers as we begin to reopen the state. We need a clear way for workers who are exposed at work to get the benefits that they deserve. And it's important to point out that the more we learn, the more we understand that COVID-19 is not a couple of weeks and you're better. There are long-term effects that people may need to deal with. Workers' comp is a really important benefit to ensure that they can get the paid time off, that they can get the benefits they deserve without depleting paid time off banks, and to ensure also for family members that lose someone that they get those critical benefits that are due to them, as well as benefits for funeral services and other things that we know can be so costly. I've talked about data and surveillance a few times. We've been really pushing around this issue. We actually successfully got a bill passed to require that occupation be collected, but the data that is being presented so far, occupation is still missing in 80% of what is being posted on the state's website. We're working with the Department of Public Health to improve that and ensure that they're collecting this data at the local level. But for now, we have a modified victory, and we'll continue to work to ensure that we can really identify and protect workers most affected by the virus through data and surveillance. Additional compensation for critical work is huge. Hazard pay. There's a campaign going on right now for grocery store workers in UFCW in Massachusetts because Stop and Shop is trying to end their hazard pay. Yet, as far as I know, the pandemic is still raging, and working in a grocery store for 6 to 8 hours a day is a huge risk. And these folks are there putting their lives aligned to ensure that we can get the food that we need and feed our families. It's really critical to support and dish hazard pay for those essential workers and those on the front line. And as much paid sick time is needed to care for yourself or a family member should they contract COVID-19. And there's a campaign in Massachusetts to add an additional 10 work days to the required paid time off that the federal government has issued. And this is largely not just to care for yourself, but also to care for family members who may have COVID-19. Then for MassCOSH, we have a worker center which supports immigrant workers, and we are seeing these low-wage immigrant workers affected even more so than other workers by the pandemic. If they haven't lost their jobs, then they're at risk of unsafe conditions, working in meatpacking plants and other kinds of businesses that have never closed, yet without the kind of support and protections they need. So we really have been calling and working towards improving additional protection for immigrant and low-wage workers. And I wanted to also end with what MassCOSH has been doing to protect workers and provide resources, because what we have seen, and I think is very true, not just in Massachusetts, but across the country, is that workers have essentially been left to fend for themselves. OSHA is missing in action. They passed the buck to states. The state of Massachusetts has put standards online that are not enforcing. We're seeing hundreds and hundreds of complaints about unsafe conditions. We know that the only way for workers to really ensure that they have health and safety protections is for them to come together to organize. So MassCOSH has set up a whole bunch of resources for workers to be able to do that. We created a multilingual toolkit in English and Spanish. We provide free training and technical assistance, town halls and webinars with thousands of participants, mobilizing our network of occupational health and safety experts, and a hotline through our Immigrant Workers Center to protect workers. And I have just a few. This is town hall we held around the reopening, had over 2,200 participants. We did one specifically for those who are providing summer jobs for young people here in Massachusetts. We are continuing to provide summer jobs, and many of those employers of teenagers who wanted to hire young people this summer came to us for help on how to do that safely. And this is our toolkit, which is my last slide. You can find this toolkit on our website, and we update it regularly to ensure that it has the most up-to-date information. We need to update it we're in phase 3 here in Massachusetts, which is actually the final phase before a vaccine. And at this point, almost everything is open, though with restrictions of the number of people who could be inside buildings, et cetera. But we want to make sure that this toolkit remains really something that is useful for workers moving forward. That is my presentation.